What's the value of a human life, and does mental illness change that?
That's a question that South Africa is struggling to answer in the wake of a deadly health scandal. I'm Malika Bilal.
I'm Femi OK, and today's stream was pitched by Teboho Ametsing. He's a concerned South African community member who tipped us off about this scandal.
Mentally ill patients have rights like everyone else. Society will be judged by how the most vulnerable are treated. The whole system must be reviewed before we lose any more lives.
South Africa is reviewing the mental health care policy in Gauteng province, where one of the biggest health scandals to rock the nation has unfolded in recent months. 94 patients died from neglect after being transferred out of government hospitals. That's according to a new investigation. They were among about 2,000 people with serious psychiatric disorders and intellectual disabilities moved into unlicensed care facilities.
The provincial government was trying to save money and move towards community-based care, but the plan went terribly wrong. With us to talk about this from Johannesburg, we have Christine Numalo, an administrator at the Gauteng Department of Economic Development. Her sister died after being moved to an unlicensed care facility. Laura Lopez-Gonzalez is a health reporter who has covered this story extensively for the Health Journalism Centre, Becky Isa. And Bharti Patel is the National Director of the South African Federation of Mental Health. And in Cape Town, we have Quickland, Director of the Alan J. Fisher Centre for Public Mental Health. We also invited members of South Africa's national and provincial governments, and they turned us down. But guess it's good to have you with us. I'm looking at a beautiful picture here, Christine, at your wedding with your sister and a baby. What was Virginia like?
Virginia was a very fun-loving person. She loved kids, and she was just generally a very good person who didn't do nothing wrong, really. She was my big sister.
I'm looking at this face. Look at this face back here on my laptop. Those cheeks, the smile, the light in her eyes. When was the last time you saw her?
I saw her in June of 2016.
And was she ill? What would you describe her condition as?
Well, she suffered from Alzheimer's, but she was not ill. She was actually in very good health the last time I saw her. She was very happy. She looked better than she had in a while.
And she got caught up. Yeah, she got caught up in this whole mental health scandal in Gauteng. Yeah. When did you find out that she'd passed?
On the 25th of August, 2016.
Right. I'm so sorry. Yeah. The whole stream team will want to share our condolences with you. And if you could point a finger as to why your sister, that beautiful woman, why did she die, you would say what? Neglect.
Not caring and not understanding, the condition, how fragile she was, and not listening basically to the cries of the community and to the families.
Laura, as a health reporter, this is your beat. How would you describe this story?
I think it was shocking. It just kept unfolding, and people just from all sectors, from within government, from, the families, Christine and everyone was incredibly strong and very well organized from the beginning. And despite all this outcry, the thing kept happening, it kept proceeding. And I think it was people covering up and people wanting to save literally $24. So it was really incredible to watch, and it just kept going.
What struck a lot of people online, at least in what they're sharing with us, is something referenced in this tweet from Andre. He says it wasn't just the number, but also the manner of deaths. That's expected in war camps, not in these NGOs, as they're called. Another person goes into detail about what that means. This is a video comment we got from Sifiso out of Johannesburg, and here's what he told us.
As a South African mental health advocacy leader, I am appalled by the outcome of the Health Ombudsman report onto the circumstances in which 94 of our brothers and sisters that lost their lives due to negligence from the Department of Health. What saddens me is that they were relegated to unlicensed NGOs by the Gauteng Department of Health. There is no excuse for reckless action that was taken by officials of the Gauteng Department of Health. Their lives meant nothing to them.
So Barty, one of the biggest points of reaction after this news broke was that these were unlicensed facilities that were accepting patients. You've actually been on part of a team that's inspecting. What have you found?
Malika, initially, as the South African Federation for Mental Health, we've been very active together with other partners like Section 27 and SADC, together with the families, trying to warn them, the MEC for Health not to take action, as the issue was decentralization. The conditions in which these patients were transferred to the unlicensed facilities, it's inhumane. We cannot accept that the Gauteng Department of Health would have even considered placing, fragile lives in unlicensed facilities that didn't have the proper infrastructure, didn't have proper nutritional plans, nor the care and the resources to look after these patients.
Can you give us details, though? You said even in the transferring that was inhumane. What does that mean? I read some reports that said people were stacked and were tied with bed sheets. What does that mean to you? What was inhumane?
I think the entire process itself. If you look at decentralization or deinstitutionalization, one talks about upscaling community-based mental health services, making sure that our community health clinics, primary health care facilities are all in place and resourced to be able to provide decent care. But even with the transfer of these patients to other facilities, the families should have been informed, the patients themselves should have been consulted and been given the opportunity to consent whether they wanted to go. Because we now know that these patients were actually transferred to places that were even further from their communities, further from their families. And that I considered, inhumane. And yeah, it's just not acceptable.
Quick, I want to show you.
If I could
go ahead, Lauren.
Sorry.
Please.
If I could jump in, I think the report was really horrific. So it described patients being shuttled onto sometimes the back of pickup trucks, that they were shuffled around like cattle being loaded into cars, that they, the father of one patient whose son was in the last batch to be transferred out, said that these people were just like shuttled into a bus and that they were confused, and some of them were carrying their belongings in literally like just plastic bags, and that people who were not transported in wheelchairs that needed wheelchairs, so they were tied like you guys said, with bed sheets, and that some patients were transported in very bad conditions. So you're talking about oozing bed sores, just really bad, in a bad shape, without their patient files, without their medication, and to places that weren't disclosed to their families, and sometimes for months.
Laura, you shared a picture with us of a gentleman called Billy Mabo, and you were talking about conditions of where the patients were moved to. Talk about this picture here that you shared with us, and why did you send this one in particular?
So this is a picture of Billy Mabo, and his father was very active along with Christine and others in trying to get this stopped. Billy was somebody who loved history, who always wanted to know how his family was doing back home, had dreams of getting out of hospital and driving a car and getting married, even though he might not have been the strong candidate to eventually transition out of care. So his father says that he went from somebody who was talkative, who was inquisitive, to the man that you see in that photo. And those clothes were actually the clothes that Billy was transferred out of life as a Demeni in. And his dad describes him as smelling, being hungry. He was being refused water. And his dad just looked at us and said, "I saw death in my son's face."
Goodness me. I want to share with you a comment from the former editor of the Financial Mail, Crick, and it says, if 94 mental patients had died from official negligence in a normal democracy, the entire national government would have been forced to resign. When you first got wind of this story, Crick, what was your first reaction?
Yeah, I think it's a terrible tragedy, and it's especially a tragedy in light of the fact that we have an excellent national mental health policy and a Mental Health Care Act that's well aligned with the WHO principles and human rights standards.
That's the strange thing. I mean, tell us about this. It's almost like a gold-plated mental health policy written down, What is it?
Exactly.
Yeah, tell us about it.
Well, the mental health policy provides for the development of community-based mental health care, the strengthening of primary health care systems, the scaling up of mental health care through primary care, which is really what the World Health Organization is advocating. And the block has really come at the level of provincial departments of health, which ultimately hold the purse strings for budget allocations for mental health care. And we know historically that on the whole, the provincial departments of health have not followed national recommendations and have not provided adequate resources, budgets, staffing, and facilities for mental health care. So the tragedy of this whole thing is that it was an attempt to deinstitutionalize, but it was driven by budgetary concerns. And deinstitutionalization should never be driven by budgets. It should be based on providing people with more humane care in the community, close to where they live and work, so that people, even living with a severe mental illness, can live a life of dignity and be provided with protection for their human rights.
So you mentioned more humane care. There are some recommendations online from people who say how this should be done, how to go about this. This is Shinaz on Twitter. She says the model must be patient-centered, recognizing the dignity of the individual, the family, and the community. We also got a video comment from someone who is a mental health professional, and she also is living with schizophrenia, so she is well-versed on this topic. This is Charlene, and here's what she told us.
Access to high-quality healthcare and services is a fundamental right, and therefore must be provided in a manner that respects and protects the human rights of persons with psychosocial and intellectual disabilities, with a person-centered approach, and where these individuals are the key partners in their own treatment and recovery plans, as well as in the provision of quality mental health care services.
Crick, a patient-centered approach, is that being done anywhere as best as you know?
Yeah, so there are some quite exciting models that are being developed to promote a patient-centered approach. We've been involved in partnering with the National Department of Health to develop a model for integrating mental health into primary health care in the Northwest Province in the Dr. Kenneth Kaunda district. And over the last 4 or 5 years, we've worked to develop a template for a district mental health care plan, and we're now scaling up that model in a couple of other districts, one in KwaZulu-Natal province and another in Mpumalanga province. So these are very exciting developments, and there's certainly pockets of excellence. I think the next step is to encourage and really obligate the provincial departments of health to simply implement the National Mental Health Policy and the Mental Health Care Act. That is where the block is currently.
Christine, what do you make of the idea of Virginia going out of an institution, out of an institutional facility, and then into the community? Do you, in principle, do you object to that?
No, I don't. In principle, it's actually a good plan because ideally you don't want to travel long distances to see your family. You would like to be able to pop in any time you could see her rather than having to wait till the end of the month before you could actually see her. So the idea in principle is very good, and I really applaud it, but the manner in which it was done was clearly not done right.
It says here, I've just got the former MEC, member of the Executive Council for Gauteng for Health, and she says here amongst the statement that the deinstitutionalization of mental health patients is a sound and internationally recognized program. In fact, the World Health Organization are actually coming to help you in South Africa because of this crisis that you had with 94 residents dying. Barty, how do you take this forward with these tragic loss of lives? How do you say South Africa is actually ready to do this? Or is there a period of time where you have to go, actually, we're not ready, we have to prepare better?
I think it's you know, like Crick said, there are wonderful programs that are already existing. Unfortunately, you know, NGOs have all been tainted now with a negative brush, and that's the sad part of it, because a lot of them are doing wonderful work and making sure that people are cared for in the communities. If we look at where we are right now, the mental health policy framework is there. It's been launched in 2013. What we do need is a commitment from all provincial departments of health. But it's also not only a program within health. We've got to look at a multi-sectoral approach so that when you look at the care of an individual, it's not only the health, it's actually the social services, transport, education, and even employment. So one has to look at, yes, South Africa is ready. And I think we just need to get the commitment.
So Barty, let me just, I just want to check this. You think South Africa is ready for community care of people who have mental health challenges? So why did this happen then? If South Africa is ready, why did this happen? Christine, this is something that you should really be asking Barty. Do you feel comfortable that South Africa is ready?
I don't think so. I don't think we are, because we have not taken the time to actually, you see, the problem with mental health is that it's got the stigma attached to it. And we haven't taken the time to actually educate people about mental health. So for it to go into the community at this stage is also just, you know, another risk that you're actually putting these patients through. So it's a process, and it needs to be piloted. It needs to be done on a small scale. And actually, you know, once those recommendations and once that project actually works, then you'll be able to actually, you know, scale it bigger. But it's got to be done in a small way, in a pilot process, and then actually those outcomes be used to actually better as you go along. But at the moment right now, with this incident having happened, I actually think we really need to go back and take stock of our situation.
You know, Christine, you started that sentence by saying that you don't think so. You don't think South Africa is ready. There's an answer on Twitter from someone who's in line with your thinking. This is Diana, and she sums it up in one word. She says the problem is funding. Another person on Twitter, this is Garrett, who says the spirit behind deinstitutionalization was distorted and manipulated by an austerity agenda. Laura, does this all boil down to money or allocation of resources?
I think it's a little bit of both. So I think austerity measures are happening in provincial health departments. I think that there's research that shows that within the last 15 years, the cost of employment has actually risen quite a bit and now accounts for about 60% of health budgets at provincial level. So you're finding provinces having to operate with less and less money, which is why the Life As Money decision was taken. It wasn't taken for better care. It was taken really as a cost containment measure. So I think that as that pressure is being felt nationwide, there's a real danger in that. And mental health has been chronically underfunded, and I don't think we're in a fiscal sort of environment where it's likely to become better funded. And I think that's a real concern.
Quick, let me share this with you. We were talking to our online community about how do we move forward from here? What needs to change? And Shanaz says, what needs to change? The attitude towards mental health that led to this tragedy. What's your take on that? Is it a mindset that needs to change, or are you already there in South Africa?
Well, again, I think it's really vital that we have a national mental health education program. And again, this is one of the key cornerstones of our national mental health policy. It's something that the government has signed up for, is to inform people about mental health and about mental illness, and integrate mental health into primary care systems. I just want to pick up on a point that Barty made early on, which I think is really essential, and that is that mental health isn't just a health issue. It's a broader social and economic development issue. So we've found in one of our studies that the indirect costs associated with mental illness through lost income and lost productivity far outweighs the direct spending on mental health care in South Africa. In other words, at a societal level, it's actually costing us more to not treat mental illness than to treat it. And we really need this broader social and economic perspective on mental health care in order to motivate for and devote adequate resources for mental health.
You know, I want to share one view with you. This is Nigel. He says there's a need to destigmatize mental illness in the same manner that we managed to do so with HIV. Another person says South Africa is not there yet. So this is Zamu, and he's pretty disappointed in the reaction that he's seen so far following the reports of these deaths. Have a look.
there has not been a call for our flags to be flown at half-mast for a public and popular grief where we can recognize that we lost approximately 100 people. And I think this points to the fact that the psychiatric patient is not seen as fully human, that once they're inflicted by an ailment, a psychiatric or a psychological condition, in many ways to society, they're already dead. I'd like to use this opportunity to draw attention to the fact that psychiatric patients are not given the dignity and the constitutional rights that everybody else in the country is, and that is not okay.
Zamo is a clinical psychologist. So Christine, I'm wondering what you're thinking when you hear his point of view there. Alzheimer's, what your sister had, is not something that ordinarily leads to death.
It's true, very true. But, you know, it goes back to that destigmatization. As soon, you know, people need to be given a chance to learn about this. Because what's happening is, I don't know, you know, if people know how to treat this, then we won't need to institutionalize our family members. Then we would be comfortable in dealing with them. Obviously, only severe cases would have to go into institutions. But for as long as there's a stigma attached to this process, exactly like what the HIV/AIDS situation was, we will not actually be able to get anywhere.
Let me play this for you. This is from the ENCA News in South Africa, and I'll play it to you. You'll understand what it is.
I would like to announce that last night I received a letter of resignation from Ms. Qedani Mahlangu as the MEC for Health and as a member of the Gauteng Provincial Legislature. I have accepted her resignation. And I would have taken action because, in any case, this is a very serious matter.
Laura, where are we in this story now? We have this resignation, high-level resignation. Does that mean that the situation is resolved? Are there legal cases going on? Where are we?
I think most people really feel that her resignation is not enough. I don't think that, I'm not a legal expert, but South Africa does have a lot of legislation in place, particularly with government officials, that does allow them to be prosecuted for things that they did while in office or was done under their watch, even after they've left office. So she may face prosecution for that. There is talk of a class action suit being filed. And I'd be interested to know from Christine where the families are in terms of possible litigation themselves.
Christine?
Well, we basically have gathered as many family members as we could, and we're going to be meeting tomorrow. But the idea is that her resignation is not enough. In fact, it's actually quite an insult to the family members. After she had insistently, insisted on going ahead with this move of closing the hospital. So there's no ways we could let her off right now. So yes, we will be proceeding.
I fully agree with Christine. I think, you know, even from an NGO perspective, you know, the actions of leaders, especially within the Gauteng Department of Health, should be brought to book. They should be accountable. A resignation is not an excuse. Like, you know, there are mental health teams going out and trying to rectify the situation. And, you know, it took the MEC a whole year and a half on insisting that this plan of hers goes forward. And in that, she's destroyed not only the 94 lives that were lost, but a whole nation has been embarrassed by her actions.
All right, guests, we will continue our conversation. If you're watching this in South Africa and around the world, we want you to move from the TV or from online and go to stream.aljazeera.com. We will be picking up in our post show, stream.aljazeera.com. How's this conversation gone down online, Malika?
I'll leave us with this tweet from Andre, who says this is broken trust that needs to be restored.
Thank you to our guests. We'll see you in a moment in our post show. Thanks everybody for taking part. Take care. Hello everybody, I'm glad you found us online. I want to start this part of our conversation by playing a little clip from an Al Jazeera report that we did on this very story. It's the Health Ombudsman for the South African government. Have a listen to him as to where are we right now. Have a listen.
I am really concerned that patients are still at risk and more patients are likely to die. And one of my recommendations was that the provincial departments and the national department must go and remove all these patients and try and accommodate them in places that are licensed.
That's deeply disturbing. Malika.
And I don't think people online are necessarily convinced. This is Andre, who we read just as we were entering into the post show. I want to read his full tweet here. He says, broken trust between state, NGOs, and community needs to be restored. Public hearings, genuine apologies are needed. There's also someone who sent us a video comment, and he says the worst part about this is that it was preventable. It's a point, Crick, you were making a little bit earlier. He elaborates on it. This is Santosh.
The most shameful part of this has been that it was entirely preventable. The Gauteng Department of Health did not heed expert advice and instead showed the arrogance of power by going ahead and deinstitutionalizing patient care without the necessary forethought. Because deinstitutionalization is not some cheap, cost-effective mechanism to save a few rands. It is in fact a very resource-intensive process that requires proper planning. South Africa has a very impressive national mental health policy framework and strategic plan signed by our National Health Minister in 2013. But if we open this document, most of the deadlines have not been reached and implementation is a major problem. I really hope that we stop using a lack of resources as the go-to scapegoat, when in fact it's a lack of decisive and informed leadership.
So Bharti, you're nodding your head there. You're due to turn in your report following the inspections at the end of this week, right? What are you expecting to happen after?
Well, you know, we do have a wonderful policy, and I think, again, I must reiterate that, you know, with the National Department of Health committed to implement the policy, we do need to review our Mental Health Care Act so that we can make provincial departments accountable to the national department so that we can ensure implementation does take place.
I'm just looking at how much 100 South African rand is in dollars, and it's about $8 US. No, don't come to my computer because it's just me Googling, doing some research while I'm live on the air. Get off my computer, thank you. Laura, the idea of this cost saving, do you know what the cost saving was as you were reporting this story out?
It was very hard to get figures from the Gauteng Department of Health.
I had 100 rand a day was what
she wanted.
What the MEC was hoping for. 100 rand a day. 100 rand a day is $8 US. Christine, your sister,
yes,
that beautiful woman, $8 US a day. Is that possible?
A day.
That's
impossible.
How is
totally
that even possible?
Impossible. I mean, that's for food, that's for medication, that's for the facility itself. That's impossible. Nobody can live like that.
I think it just shows the lack of understanding of the needs of a mental health care patient. You know, again, it's the stigma Christine is talking about. It's stigma, but it's also disrespect and lack of dignity. Just because a person has a mental health condition, you know, we live in very poverty-stricken, we have marginalized communities. And again, it's, you know, the very affluent making decisions for the poverty-stricken. And it's quite insulting.
And Femi, I just wanted to jump in quickly and just say that the people that we talked to that were doing this sort of right, like a best case example, said that it wasn't the cost saving, that you weren't going to save money doing it. You were going to spend more money because it's like Santosh said, resource intensive.
Yeah. Crick, your thoughts, final thoughts?
Yeah, so I think this is really hopefully going to spur the Departments of Health at the provincial level into some kind of action. There are very clear targets and indicators. The National Mental Health Policy Framework sets these out. These include establishing district mental health teams, one in each district, training primary care nurses to detect common problems like depression, alcohol use disorders, training community health workers to provide support for people living with schizophrenia and bipolar disorder in the community. All of these things are achievable. We have the tools, we have the resources. It's really about the political will and allocating the appropriate budgets. And it really has to happen now. It's become a national emergency around this.
Sure. Malika.
I'll give the final word to Pancho on Twitter, who says this tragedy, this scandal, it shows how neglected mental health issues are in South Africa, but it also shows, in his view, how the government's disregard for vulnerable people is evident.
Just ending where I started, which is with a picture of your sister, Virginia, and I'm just thinking, what do you think her legacy should be? What would you like it to be?
Well, that at least from now on, this will not happen again, and that mental health patients will not be treated like that they don't matter, they're not part of the society, you know, and that the fact that no one else will die in this manner, because this was a horrific way to die, and no one should ever be subjected to this, ever.
Christine and Laura and Barty and Craig, thank you for being part of this conversation. Let's see what happens in South Africa. Take care, everybody.